Hi guys, good day to each and everyone. I am Dr. Sergi Deloso and we have a patient here. Si Oli. So, bali si Oli, galing siyang Manila. Okay, he was referred by a friend. So, meron siyang problema sa hip. Actually, he has a femoral neck fracture. So, kapag may femoral neck fracture, there are certain procedures na pwede natin gawin para maayos yung problema. So, pinakauna, we could basically fix it. Okay? So, kapag gold standard when it comes to femoral neck, femoral head fractures, syempre nandiyan na si hip replacements, Kaya lang ang problema, she's a very young animal, so lalaki pa siya. So yung dependency niya sa laki ng implants na kakailanganin, it will basically depend dun sa adult size niya. So syempre dahil lalaki pa siya, total hip replacement is not a good treatment of choice or surgical treatment of choice. Pangalawa would be yung fixation. So we could fix it actually. Maglalagay lang tayo ng IM pin doon sa kanyang femoral neck para maikabit siya doon sa sa greater trochanter. Okay? Kaya lang ang problema rin, it will also depend kung gaano nakatagal yung fracture na nangyari. Sadly, the fracture had been there for at least siguro 2 weeks or more. So syempre, meron ng technical difficulty to fix that type of fracture in the sense na he's a relatively young animal, he's only 5 years old, 5 months old, So syempre, nag-heal na siya. So callus kumbaga nagkakaroon ng scar tissue formation sa area, so it would be very difficult for us to reduce it properly. So, ayun. So, we also told that to the client na pwede pa naman siya maayos using that type of procedure, and we also told that pwede rin naman siyang gawin to simply just remove the femoral head na fracture and then simply do an FHO. Kaya lang sa FHO naman, in-explain ko rin that there could also be a possibility na magkakaroon siya ng tinatawag natin na bone spur. Remember, these are relatively young animals, so mabilis ang healing nila. So once na kinat mo yan o nagkaroon ng osteotomy, there's a possibility na may tutubong buto doon sa area that could lead into anong tawag dito, osteoarthritis, dahil gagasgas yung buto na tumubo doon sa part ng osteotomy. So anyway, makikita nyo naman sa screen kung ano yung tsura nung fracture niya. Okay, so well, we explained everything to the owner, kung ano yung mga options na pwede natin gawin, and the owner opted for an FHO or FHNO or excision arthroplasty. Depende na lang kung anong tawag dyan. Okay. So, we are going to do that today. So, we'll take you to theater kung ano yung tsura niya, and hopefully may pakita rin namin kung ano yung tsura nung post-op x-ray niya. Ngayon, maraming nagtatanong, Doc, FHO. Yes, to be honest, I've done a lot of it. To the record, more than 200 na nagawa akong ganyan. So, ano ba yung common complications? The worst complication that I had, based on my experience, is an infection kasi napabayaan ng owner. But basically, all of them walk naman, naglakad naman sila. The main goal of surgery actually is not to have a perfect leg. Kasi basically, pag tinatanong, Dok, pag chinap mo ba yan? So paano na yun, maglalakad, So the leg will be a little bit shorter compared to the other leg, which is the good leg. But that's not a problem. Why? Hindi siya problema kasi dog stand on an angle. Ibig sabihin, yung aso kasi nakatayo sila, angle Diba? Hindi naman sila nakatayo ng straight. So halos parang hindi mo napapansin yun. But if you're a keen observer, you would definitely notice it. And the main goal of surgery actually is not to have a perfect leg, but to have a pain-free leg. So, ano mas gugustuhin natin? Masakit na paa o hindi masakit na paa? Of course, we would choose rather have a pain-free leg, It also has its own limitations, and if not performed properly, okay, it also have a lot of complications. So, although it's a routine procedure that we do, we still warn owners about those complications that could happen, especially on large breeds of dog. Ayun. So, hopefully, maging okay siya. So, we already pre-medicated him with pain meds and analgesics, and of course yung pre-operative antibiotics niya. And then we'll proceed to surgery. But anyway, before we proceed to surgery, SOP sa lahat ng ginagawa namin dito, we do first pre-operative x-ray. Kasi nangyari na may nagpadala, mali yung marker. So luckily, we still do x-ray first before surgery, and likewise x-ray again to ensure that there is proper surgical cut. Okay, so hopefully we'll take you there. So ayun, see you soon. Again, I'm Dr. Serdi, and you are at Deloso Vet. Thanks.